Association of Public and Environmental Health Officers on Saturday at a press conference held at Palma revealed to the media that they are about to embark on a sit-down strike on the 5th of May if their demands are not fulfilled by the Ministry of Health. Musanget, Vice President of the Association of Public and Environmental Health Officers, reading the statement said the general membership of the Association of Public and Environmental Health Officers have agreed unanimously as an association with mass representation of the Ministry of Health strongly recommend the allowance issue be solved before the 5th of May 2022 or risk industrial action. In this, the public health officers across the country will lay down their tools.
In early 2021, the Minister of Health proposed to create a specific allowance for the health minister, PhD holders, and medical doctors serving the Ministry of Health. This, we believe, was very discriminatory and had caused unprecedented chaos, not only within the public health cadre, but within the entire Ministry of Health. The decision came as a shock to the cadre, and since then, a host of avenues have been explored for the inclusion of other cadres into the new allowance scheme. The leadership of the association therefore deemed it fitting to collaborate with other sister cadres who are being unfairly excluded from the new allowance scheme. In its first letter that was addressed to the Secretary General and Head of Civil Service dated 2nd March 2021, the association, in collaboration with the National Pharmacy Staff Association, highlighted their dissatisfaction regarding the bizarre decision sought for.
He added that they seek for immediate suspension on the recent approval of allowances for few selected individuals, which is described as discriminatory and unfair to the hard-working directors, program managers, program officers, health facility staff and frontliners, and use the allowance proposed to initiate the appointment of health laborers, workmen, orderlies across the country as soon as possible, while some are volunteers for over 2 years without salary. Initiate a review for allowance increment for all cadres in the Ministry of Health.
Executive came to an end. The new executive was elected in January 2022 to continue running the affairs of public and environmental health officers in the country. On the 8th of February 2022, the executive of APEC made their first courtesy call on the Director of Public Health Services and also discussed many issues affecting public health officers and the services they provide to the public. Among the many pressing issues tabled were the exclusion of the public health officers in the newly developed allowance scheme for the Ministry of Health staff, among others. In his response, the Director of Public Health Service said his office is working tirelessly with the various stakeholders, that is HR, Ministry of Health, Permanent Secretary, and then the PMO, to resolve the problem so that PHOs can receive the allowance like other cadres that are currently benefiting. He further stated that subsequent meetings on the allowance issue is scheduled for 9th February 2022. In a similar but different meeting on the 25th of February 2022, the executive was able to meet with the Permanent Secretary, Minister of Health, to introduce the new executive and moreover discuss matters affecting the public health cadre as well as the newly established Public Health Council. Among the issues discussed include an office space for the Public Health Council and then the exclusion of public health environmental officers from the Ministry of Health allowance scheme.
He added that the response received from Permanent Secretary, Ministry of Health, indicated that Director of Public Health Services and Director, HR, Ministry of Health, and himself had a meeting with the Permanent Secretary for the allocation of similar allowance to other cadres within the Ministry of Health. The Human Resources Unit of Ministry of Health is assigned to quickly work on this, but executive and the entire membership are strongly concerned about the long silence of the PMO upon receipt of the requested information from HR, Ministry of Health, and that while they all provide the same service to the population and that there might seem to have been differently from their sister cadres, which the General Orders and Civil Service Code of Conduct do not support. However, the Vice President further summarized the functions of the Association of Public and Environmental Health Officers and reassured all members that as long as they align with the decisions of the association, the executive and the entire association will be their guard against any unforeseen circumstances.
Officers in the Gambia. 1. Surveillance and disease control, including contact tracing, especially during the peak period of COVID-19. 2. Screening of travelers at the points of entry, including the airport and the seaport. 3. Enforcement of COVID-19 regulations across the country. 4. environmental, water and sanitation monitoring. 5. Administration of vaccines to adults and under 5. 6. Public education on emerging and re-emerging diseases. 7. Screening and registration of births and deaths. Disinfection and burial of dead. Exhumation and the infection, just to name a few.
The Association of Public and Environmental Officers is a registered non-profitable association of public health professionals in the Gambia. The association has been in existence since 1971, generously serving the health professionals. The membership of the association is consisted of both private and government health practitioners respectively. Reporting for Kairaba News Network, Mama A. Toure.